Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 45, Silicea-1. Mode of action. Details of its mode of action is still not available. Silica, that is Silicea. Silicea, the alternative name is common name is Silica. Silica is there in human epidermis, nails, hair and connective tissues. When some undesirable substances like mass of boil, tumors, etc. are formed in the body by physiological process, Silicea either arrests the inflammation or matches the process to create inflammatory fluid to heal site naturally. Again, when foreign materials like nails, pins, thorns, etc. enter our body, Silicea, through its wonderful action, throws them outside, creating pus and finally repairs the site naturally. In modern medicine, in many cases, what the surgeons used to do with their scalpel, lancet, scissors, etc., the same is performed by this remedy naturally without any instrument. Systematically, it also acts on bones, joint structure, glands, mucous membrane, skin, etc. to eradicate the constitutional dyscrasia of children suffering from scrofula. You see, here the term scrofula in modern science, scrofula is just in modern science, scrofula means this cervical adenitis or the cervical glands. There are so many glands in the cervix area, neck area, that cervical lymph glands adenitis, inflammation. That is modern scrofula. But in homeopathy, scrofula has got a big meaning. Big meaning. This scrofula means actually it is inherent, or rather tuberculosis, taint of tuberculosis earned from birth, and that makes a big difference in the life of the child. In homeopathy, this is called scrofulosis. But in modern science, scrofula has got meaning, but much narrower sense. In homeopathy, the sense is much wider. Due to lack of silica, connective tissues are dried up. Please remember, if after decrement of inflammatory processes, secretion of pus goes on days after days instead of drying up, then calcareous salve is required. That is, sometimes it happens, inflammation stops, but secretion of pus actually goes on days after day. In that case, actually, Silicea will not work. You have to take the help of calcareous salve in that case. Diseases generated after suppression of sweat, especially foot sweat, Silicea is highly efficacious. For bad effects of vaccination and silicosis of stone cutter, it is infallible. Mind it, stone cutter silicosis is a very painful, not painful, rather fatal disease, I will call it, fatal disease. A lot of stone cutter used to die prematurely due to this silicosis. And in modern medicine, there is particularly not much medicine is there. But Silicea helps a lot in this case. If you got a patient of silicosis, you please try it and you will be amazed to see the effect of Silicea here. Silicea for mental cases. Brain fag. School students cannot remember lessons, cannot think, cannot concentrate, confused while reciting or answering questions in class because of lack of concentration, irritable, despair of life, anxious, angry from trifles. Children have queer interest of playing with pins, needles for hours. Very much sensitive to external impression like sound, light, noises, etc. Cannot finish an assigned job in time because of tiredness after a little work. Though they fear to start a job, but once started, complete it successfully. Silicea for head and scalp symptoms. Owing to problems in internal ear, tendency to fall down on the left side or in front. You know, internal ear, one of the functions of internal ear is to keep the balance, body balance. When internal ear is affected, this body balance is disturbed. That's why the patient tends to fall. Headache from tired nerves. Headache from tired nerves, excessive study, abdominal irritation, hunger or vertigo. Throbbing pain as if head would break down into two parts. Cold sensation in the head. Likes to cover the scalp with warm covering. This is a constant feature of a Silicea patient. They are so cold that they even want this covering in summer. Pains from neck to vertex, more felt on the right side. Worse from noise, light, study, exertion. Better from application of heat. After severe stitching pain deep inside the right parietal area, this is right parietal bone. Within this right parietal bone, that is in the brain, deep stitching pain is felt. Better from application of heat. After severe stitching pain deep inside the parietal bone and intense spasmodic pain in arm, cerebral apoplexy occurs. That is, these are the premonitory symptoms of apoplexy. Apoplexy, you know, apoplexy is some sort of very deep acting neurogenic disease. That neurogenic disease is also looked after by Silicea if this symptom corresponds. After stitching pain deep inside the right parietal area and intense spasmodic pain in arms, cerebral apoplexy occurs. Scalp so sensitive that it can't be touched. Painful pimples, pus discharging wounds, itching. Sweating much on scalps of children with open fontanelle. This is open fontanelle. On the scalp, open fontanelle. Hair falls off, nodules on scalp. Various types of nodules on scalp. This is apoplexy. It's completely nervous disease, neurogenic in character. Silicea for eye symptoms. Fistulous wounds in lacrimal ducts, styes, blepharitis, tarsal tumors, pustular blepharitis. Note this picture here. This is lacrimal apparatus. This is lacrimal gland or tear gland, where from tear comes out, and this tear washing the eyes comes through these fine channels in the internal canthus of the eye into this duct along the nasal passage, and the water passes in this way. That's why we occasionally see when there is more tear, the nose is moist, because this tear comes out through nasal passage. This is called, total thing is called lacrimal apparatus. Now this lacrimal apparatus might have sometimes it have some abnormal fistula. That is, normal opening is this, but there is another opening here. This is fistula. That fistula is called lacrimal fistula, and Silicea completely cure this type of lacrimal fistula. Pustular blepharitis. Blepharitis actually eyelids inflammation. Corneal ulcers. Small circular types that create holes and sloughing ulcers. That happens within the cornea. Amblyopia. Amblyopia is a peculiar thing. Generally, with both eyes, we see a particular object in the same order, that is same brightness, same contrast. But sometimes it happens that one eye is not following normal way. One eye is normal. That eye is developing the picture correctly, but another eye is so damaged that its vision is some dim, and naturally the picture created by that eye, single eye, is not normal, rather weak. This type of disease is called amblyopia. Amblyopia, you cannot know. This is only can be tested only through by ocular expert. I mean eye expert. They can test and say, yes, this person is suffering from amblyopia. If you have got that patient, that this patient is suffering from amblyopia, you can use this medicine, because generally you cannot know when a patient, or whether a particular patient is suffering from amblyopia or not. This amblyopia sometimes comes from suppression of foot sweat or skin disease. Skin disease is suppressed or foot sweat suppressed, amblyopia develops. If this happens, then Silicea is the medicine. After smallpox, scars on cornea, opacity. After smallpox over, now on cornea scar comes, but on cornea there is opacity, that is the transparency of cornea is lost. Severe neuralgia, cluster headache. This is actually hemicrania or partial headache, headache on particular side, especially on right side. High pressure in orbits. Orbits means the eye socket where eye is set. Soreness there. Musky volatility. Musky volatility is in the vision field. There is some floating objects that disturb the vision. Musky volatility. During reading sensation as if letters were running jointly. Necrosis of orbit. The orbit is necrosed with this thing. The orbit is necrosed, destruct. These all diseases are addressed by Silicea. It is very difficult to believe, but it is so. If you can carry on with this ear tissue salt seriously, at the end of say practicing 10 to 15 years, you can know this medicine can what they can do beyond your imagination. Please just keep trust on your medicine and you go on reading, collect information, you will know what your tissue salt can do. Silicea for ear symptoms. Intense sound intolerable. Otitis after bath. Roaring in the ear. Roaring in the ear. Otitis media, especially pus discharging chronic otitis. Otitis means actually inflammation of ears. Otitis externa, external ear otitis. Hard of hearing from swelling and inflammation of Eustachian tube. This is Eustachian tube, you know, this tube. This is the tube which connects the throat and middle ear. This is middle ear. Mid-ear, it is like middle ear. Middle ear actually have mainly two parts. One is Eustachian tube, another in three small bones, you know, malleus incustipis, and this small space that's called tympanic membrane. Tympanic, this is not tympanic membrane, this is a covering. This external ear, the covering is called tympanic membrane. This is called tympanic cavity. This particular box is called tympanic cavity. Listen here, tympanic cavity, small letter is written, tympanic cavity. Now, tympanic cavity. The hard of hearing from swelling and inflammation of Eustachian tube and tympanic cavity, necrosis of the mastoid cells, mastoid air cells. This is mastoid air cell. Where it is the where at this is mastoid air cells. This is the location of the mastoid process. Just actually you can call it just behind the ear. Just behind the ear, if you put your finger, you will feel a hard bony spot. That is called mastoid bone. That bone actually is fill up with air cells. That is, these air cells are lying within the bony case. But when inflammation occurs, these mastoid air cells are destroyed. That is within necrosis of mastoid air cells. Discharge of thick acrid pus. From this pus will come your mid-ear, that is middle part of the ear, and it will pass through either Eustachian to your throat, or if there is tympanic membrane is destroyed, then that pus will pass out through external ear tube, that is this tube. Both is possible. Either it will come this way or it will go to this way to throat. This is another very complex and chronic disease, and you cannot your ordinary mind cannot simply believe that it is possible to cure this type of bad diseases with the help of Silicea. Yes, again I am saying it is possible. It is possible because hundreds of years ago, the top ranking tissue salt therapists of America and other modern countries used to cure this type of disease. I have collected this information from that type of book. So this is necrosis of mastoid air cells, discharge of thick acrid pus, deafness, occasionally ear block opens up with a bang. This, when you possibly sometime you personally might have experienced it, that your ear is blocked, but suddenly with a sound, with a click sound, with a clack sound, it is opened up. This is also a symptom of Silicea.